Je ne t'entends pas très bien. Connexion n'est pas très bonne. Hein. Je vais envoyer un message. La connexion n'est pas très bonne. Le son n'est pas très bon. Je vais envoyer un message.
Hi, good morning, good afternoon. This is technician. Uh, Please remember, you will mute your microphone all the times and unmute only when you want to speak. And your video should be muted also all the time. You can unmute your video and of course audio when you want to speak. Otherwise, all the time keep your microphone and camera muted. So it's already 59. We have just 1 minute. So at this time, please mute your camera. Only the moderator, Mr. Supulwa, will have his, who is going to open the floor. He's the moderator. He will be full screen. So others can please mute your microphone. But if somebody is not, please mute your microphone and close your camera, switch off your camera. You will open your camera when you have the floor, and you will open the microphone also that time to speak. Thank you. Miss Ratna Patton, if you can also close your camera. Thank you very much. Mr. Kim Hero, can you hear me, sir? Can you unmute and talk to me? Since you joined, we didn't do the audio test.
I hear you very clearly. Thank you very much.
All right, sir. You are good. And
I'm
please.
fine, I'm fine. I'm just trying to fix my machine. Just hold on.
Okay, you are good now, sir. So you
Okay.
can close your camera now. You are perfectly in a good frame, and the moderator is Mr. Chulwa. He will go ahead. Thank you, sir. You can close your camera, Mr. Kimishiro. Thank you.
Unmute. I have to unmute.
Yeah, mute your microphone and also close your camera. You will open your microphone and camera when you want to speak. Thank you, sir.
Good morning and good afternoon. I am honored to invite you today to commemorate the 6th official observance of the International Day for the Elimination of Sexual Violence in Conflict, co-hosted by the Permanent Mission of Argentina to the United Nations, the Office of the Special Representative of the Secretary General on Sexual Violence in Conflict, and the Office of the Special Representative of the Secretary General for Children and Armed Conflict. This event is being webcast on UNTV, and this year's commemoration is urgently and appropriately themed the impact of COVID-19 on survivors of conflict-related sexual violence. We are delighted today to welcome two special guests, Her Royal Highness the Countess of Wessex, a champion of this cause, as well as Madame Chantal Moulop, who is the Special Advisor to the President of the Democratic Republic of Congo, responsible for the implementation of the joint communique on conflict-related sexual violence between the United Nations and the government of the DRC. We will also have several voices from the field, as well as civil society perspective, and we're honored also to have several interventions by champion member states. I'm glad now to give the floor in our opening segment to the Chargé d'Affaires of the Mission of Argentina to the United Nations. Ambassador, you have the floor. Thank you.
Thank you very much. Excellencies, dear colleagues, distinguished guests, good morning and welcome to this special event which marks the formal observance at the United Nations of the International Day for the Elimination of Sexual Violence in Conflict. It is an honor for Argentina to be hosting, once again, together with the offices of the special representatives of the Secretary General on Sexual Violence in Conflict and for Children and Armed Conflict, a special event in commemoration. We are gathered here today to commemorate this International Day, whose objectives are to raise awareness of the need to prevent, put an end, and fight impunity for crimes of sexual-related sexual violence, foster solidarity with the survivors of sexual violence around the world, and to pay tribute to all those who are courageously working on the front lines for the eradication of these crimes. As you recall, the International Day was established by the General Assembly in 2015 through the Resolution 69/293, which was an initiative put forward by Argentina together with the offices of the CRSGs on sexual violence in conflict and children and armed conflict. This commemoration is not just another one. It is especially in the context of the COVID-19 crisis. This is why the theme for this year's observance is the impact of COVID-19 on survivors of conflict-related sexual violence. As it is mentioned, in the policy brief of the Special Representative of the Secretary General on Sexual Violence in Conflict, the implementation quarantines, among other measures to abate the spread of COVID-19, are hampering the possibility for survivors to report sexual violence, further exacerbating the existing structural, institutional, and socio-cultural barriers to seeking redress for such crimes. In addition, the policy brief states that COVID-19 will have a significant and detrimental impact on all aspects of the rule of law response, including accountability for CRSV. This includes limitations on the availability and capacity to receive and process reports on incidents of sexual violence and law enforcement and judicial authorities. These are only some aspects of how COVID-19 is impacting the fight against crimes related to sexual violence. In line with the Secretary General's policy briefs, responses to fight COVID-19 must adopt a human rights-based, gender-responsive, and survivors-centered approach in order to focus our attention on who are suffering most. As a matter of fact, Resolution 2416 of the Security Council, adopted last year, recognizes the need for a survivor-centered approach in preventing and responding to sexual violence in conflict, and the need for survivors to receive non-discriminatory access to services. In this context, access to essential services such as comprehensive health services, access to shelters, and access to justice are key elements. On another note, this year marks the anniversary of the landmark 1325 Security Council resolution on women, peace, and security, and also the 25th anniversary of the Beijing Declaration and Platform for Action, which compels us to reiterate the call for women to be fully engaged in all aspects of peace and security. In particular, the Resolution 1325 calls on all parties to conflict to take special measures to protect women and girls from gender-based violence, particularly rape and other forms of sexual abuse in situations of armed conflict. Dear colleagues, sexual violence in conflict is a despicable phenomenon that not only affects international peace and security, it is a human rights as well as a gender issue, a scourge that affects every society and prevents its full and sustainable development, as well as the dignity, integrity, and human rights of each individual. We hope that today's event will help us in reflecting about this issue, bearing in mind the extraordinary circumstances we are all facing and the necessary steps and measures that are needed for putting an end to these crimes through a survivor-centered approach. Thank you very much for being here today.
Ambassador, thank you very much. I'm now delighted to call on co-host, Special Representative of the Secretary General, Pramila Patton. Thank you.
France, DPR, ma'am, if you can switch off your camera, please. Thank you.
Thank you, moderator. Guest speakers and participants from around the globe. A warm welcome to the 6th official commemoration of the International Day on the Elimination of Sexual Violence Against Women. Your Excellency, Mr. Alejandro Verdi, Chargé d'Affaires of the Permanent Mission of Argentina, the United Nations, and the Secretary General, Mrs. Virginia Gamba, thank you for co-hosting this event. This annual event is an opportunity not only to raise awareness on the scourge of conflict-related sexual violence, which continues to be used as a tactic of war, terror, and political repression, but also to stand in solidarity with the survivors and those working to support them on the front lines, often at great personal risk. In 2015, when the General Assembly established the International Day, following the leadership and vision of Argentina, it reminded us all of the importance of a survivor-centered, rights-based approach. Yet, as I have seen time and time again in the field, appalling gaps remain in terms of services for those in need and resources for the grassroots civil society groups that represent a lifeline in many remote, war-torn regions. This year, we meet amid complex, overlapping crises. Many survivors are simultaneously facing armed conflict, displacement, and a global pandemic that has both exposed and exacerbated gender inequality. This has left women with a disproportionate socio-economic and care burden, and yet often with no voice in the policy decisions that affect their lives and livelihoods. Women comprise up to 70% of frontline health workers, yet they have lesser access to personal protective equipment, which is designed primarily for men. Restrictive social norms inhibit women's access to potentially life-saving information, particularly in high-risk, low-tech settings such as displacement camps. This is compounded by internet blackouts and by gender-based digital divide, which impedes the ability of local women's groups to speak out and continue their collaboration with international partners. It is estimated that 1 in 5 internally displaced or refugee women has experienced sexual violence. Yet, less than 1% of global humanitarian aid is spent on gender-based violence prevention and response. COVID-19 has, in many cases, resulted in already scarce resources being diverted to national health and sanitation systems that are overwhelmed by the pandemic and weakened by protracted conflict. Shelters, counseling services, and mobile clinics have been closed due to the reallocation of funds and to quarantine-related restrictions. The clinics that remain open are able to see fewer patients due to social distancing rules. The risk of stigmatization, rejection, and reprisals in the aftermath of rape is today overlaid with fears of contracting the virus or of being perceived as a carrier, which further complicates the decision to seek redress. Indeed, reporting sexual violence has become more difficult than ever during lockdowns, which have restricted the movement of humanitarians and human rights monitors. COVID-19 threatens to paralyze the rule of law response. The pace of justice for conflict-related sexual violence, already painfully slow, has in some cases grounded to a halt due to the closure of courts and the suspension of investigations and trials. Key security sector reform initiatives, such as the training of national armed forces on preventing and addressing sexual violence, have also been suspended. Moreover, the liberation of detainees as part of efforts to mitigate transmission of the virus has included the release of a number of convicted rapists. This endangers civilians, particularly victims and witnesses. Other new protection concerns have also surfaced, including threats against women in isolation and treatment centers. Heavy-handed militarized responses have heightened the risk of sexual abuse, including against women detained in connection with alleged curfew violations. Concerns have also been raised about sexual exploitation and trafficking in the face of economic desperation, particularly in displacement settings. Women's human rights defenders report facing not only financial, but also physical insecurity, targeted attacks in the context of shrinking civic space. Moreover, many armed and terrorist groups have taken advantage of the prevailing uncertainty to intensify their operations. Despite calls to silence the guns, acts of sexual violence by parties to armed conflict persist in the Central African Republic, the Democratic Republic of the Congo, Mali, and other settings. In the face of this unprecedented crisis, field-based specialists have continued to deliver on the mandate despite lockdowns, quarantines, curfews, shifting priorities, and ever more constrained resources. Today's event provides an important platform to hear directly from these frontline actors who will share operational updates on their efforts to keep survivors' rights and needs at the heart of the response. Women protection advisors have continued monitoring and reporting on conflict-related sexual violence as a basis for remedial action, including by deepening partnership with community-based networks to enable new referral pathways and remote case management. I thank them for their dedication, their innovation, and their tireless effort. Ladies and gentlemen, no crisis is gender neutral, and no effective response can be gender blind. Building back better in the wake of this pandemic requires an inclusive, intersectional, and gender-informed approach. This means considering the diverse realities of IDPs and refugees, ethnic minorities, indigenous and rural communities, people living with disabilities, LGBTQI individuals, and other marginalized groups to ensure that ultimately no one is left behind. The current crisis is a test of our resolve. We must not allow it to reverse the gains that have been made in recent decades to combat gender-based discrimination as a root cause and driver of gender-based violence in times of war and peace. Nor can we allow the political commitment obtained in recent years to be rolled back. Allow me to end by emphasizing 3 concrete recommendations that I have made since the advent of this crisis. Firstly, all parties to conflict must immediately cease all forms of sexual violence as part of the Secretary General's call for a global ceasefire. Compliance must be monitored and enforced. Secondly, sexual and gender-based violence response services must be designated as essential services in order to prevent their deprioritization and defunding. It is a lesson from past epidemics such as Ebola. that more women die from the lack of access to services, including reproductive care, than from the disease itself. Thirdly, efforts to address sexual and gender-based violence should be integrated into national COVID-19 response plans, including proactive measures to broadcast information to the most vulnerable. The needs of survivors cannot be put on pause, and neither can the response. I thank Argentina and all of our partners from member states, civil society, and the UN system who are working in common cause to keep this issue in focus. We cannot allow the world to look away. We cannot allow the survivors to be forgotten. Thank you for your attention.
Thank you very much, Madame Patton. I'm glad now to invite co-host Special Representative Virginia Gamba.
His Excellency Chargé d'Affaires of Argentina to the United Nations, Señor Ministro Alejandro Verdier, and the Secretary General, Mrs. Pramila Patton, colleagues from the field. Excellencies, ladies and gentlemen, it is an honor for me to commemorate with you the 2020 International Day for the Elimination of Sexual Violence in Conflict, albeit facing the added challenges brought about by the COVID-19 pandemic. My office is mandated by the General Assembly and requested by the Security Council to monitor and report on violations affecting children in situations of armed conflict. Sexual violence against boys and girls is one of the most important violations we monitor, along with the killing and maiming of children, the recruitment and use, abduction, attacks on schools and hospitals, and denial of humanitarian access. We do this through a monitoring and reporting mechanism, which verified 735 cases of sexual violence, including rape, against children in 2019, occurring in the 19 situations covered by my agenda. These figures and more detailed information can be found in the latest report of the Secretary General on Children and Armed Conflict, which was published earlier this week. But we also know that sexual violence is vastly underreported for reasons of stigma experienced by survivors, rejection by families and communities, lack of accountability for perpetrators, and lack of access to medical and other services. Excellencies, ladies and gentlemen, the COVID-19 pandemic presents the United Nations with new challenges on an unprecedented scale. On 23rd of March 2020, the Secretary General called for a global ceasefire to refocus attention on the true fight, which is defeating the pandemic. Peace remains the best way to ensure that boys and girls are maximally protected from experiencing any of the 6 grave violations, including rape and other forms of sexual violence. As the Secretary General has highlighted, the most vulnerable populations are hit the hardest by the pandemic and lockdowns. These are the women, displaced persons, and children, with children in conflict or child refugees being a disproportionate burden. Today, parties in at least 11 countries have committed to halt hostilities, including several on the Children and Armed Conflict agenda. Parties in Cameroon, Colombia, the Central African Republic, the Philippines, Sudan, Syria, and Yemen have declared ceasefires. We publicly applaud these efforts and urge other countries and parties to conflict to follow suit. I will continue to appeal to parties to halt their fire and to engage with them to protect children. Excellencies, ladies and gentlemen, while the full impact of COVID-19 on boys and girls living in armed conflict, including in situations of detention, will only be exposed over time, we know already that further lack of access to healthcare and other basic services, which are fragile at best in situations of conflict, is creating special challenges to girl and boy survivors of sexual violence that need urgent and specialized medical and psychological support. Another problem arises with COVID-19 lockdowns because This can amplify the threat to children of being subjected to violence due to greater military and armed presence in cities and villages, and of being recruited, used, abducted, or sexually violated due to push and pull factors in the economic downturn created by the lockdown measures. Lastly, the release and reintegration of children associated with parties to conflict remains a top priority. Also true for our partners such as UNICEF. However, the COVID-19 response is challenging the release and reintegration of boys and girls in many ways. For example, COVID-19 related restrictions of movement impact child protection's actors' ability to move freely and to provide children with access to the services they desperately need upon release. Such restrictions may also interrupt the release process. Reintegration support, including mental health and psychosocial support for survivors of sexual violence, is being further delayed. In some instances, governments have restricted access to verification sites, and interim care centers may be unsafe for children during the pandemic. Restrictions may also negatively impact child protection actors' ability to monitor and report on violations. The fear of COVID-19 has further amplified barriers to reporting sexual violence to child protection actors or to health workers. Hence, the survivors of sexual violence might not be reached. I'm also extremely concerned that vulnerability of boys and girls to become victims of rape and other forms of sexual violence will increase due to weakened child protection mechanisms and a reduced presence of child protection actors. In this regard, we will hear more from the women's protection advisors on the ground, but we note that while our teams remain committed to the monitoring and reporting on violations against children in armed conflict, they are also involved in general UN support to national responses to the pandemic. Our monitoring and reporting capacity may also be affected by lockdowns and other movement restrictions, and our capacity to verify information will likely be impacted. Our teams on the ground are continually evaluating the situation and developing mitigation measures, including business continuity strategies with local partners. With governments' focus pivoting towards the pandemic, as well as governmental offices and non-state armed groups in various degrees of lockdown, there is less capacity to address violations against children, including sexual violence. For all of these reasons, and in these extraordinary times, it is critical that we do not forget children affected by armed conflict when responding to the pandemic, as their protection, release, and reintegration remains more important than ever. I call, therefore, on member states to ensure that boys and girls receive the necessary support to meet their critical needs, including the specific needs of survivors of sexual violence. And I thank you for this opportunity to address you.
Thank you very much, Special Representative Virginia Gamba. We're glad now to move on to our second part of the program and to introduce our first special guest, Her Royal Highness, the Countess of Wessex. Your Royal Highness, you have the floor.
Thank you, Tandarai. And my thanks also to Special Representative Patton and Gamba and the Chargé d'Affaires from Argentina for their leadership at this time, as well as the commitment of all of you online today. Despite the world having shrunk through the power of digital platforms like this one, we know that there are an extraordinary number of people who are more and more disconnected and vulnerable, and that COVID-19 has compounded this issue. Since the pandemic began, the number of cases of sexual violence across conflict settings and in domestic settings are very likely to have risen substantially. Women and girls once again are being affected disproportionately, with increased difficulties in accessing sexual and reproductive health care, higher numbers of maternal deaths, and teenage pregnancies, closures of domestic violence shelters, closures of schools, reduction in aid work and funds for charities, delays in relief packages. COVID-19 has amplified suffering with the restrictions imposed on survivors. Time is against the victims, and therefore it is imperative that national action plans are implemented, or where possible, even accelerated. But importantly, in the course of our action, we must ensure all responses are best geared to them. My message, therefore, today is simple, and I hope I may speak for all survivors of conflict-related sexual violence when I say we must listen to the needs and wishes of all survivors, and we must act accordingly. Humanitarian programs and funding structures must be able to nimbly adapt in line with the thoughts and needs of all survivors amid this pandemic. I believe civil society is central to enabling real and meaningful global action. Local communities are able to share local knowledge and understanding. Let local realities guide global responses. So while we mark today as the International Day for the Elimination of Sexual Violence in Conflict and acknowledge the consequences of COVID-19, let us all respond by listening to the needs of survivors and with the urgency that they deserve. Thank you for this opportunity to speak to all of you today.
Miss
Thank you so much.
Switch off your camera, please. Miss Number of Katni, switch off your camera, please, as you are not speaking right now. Thank you.
Thank you very much, Your Royal Highness, for your message and for being a champion of the cause. I am delighted now to invite our second special guest, Madame Chantal Moulop, the Special Advisor of the President of the DRC. Madame Moulop, you have the floor.
Thank you. For inviting me to this important event. The mandate entrusted by the President of the Republic of Congo, the head of state, to the special advisor ensure the coordination and monitoring of the policy, reform, and programs put in place to fight against all forms of violence against women. I therefore have a mandate to end the impunity of the conflict in the region. The conflict for survivor, including a significant reduction in the provision of care services. And in conflict zone, there is almost no access to humanitarian assistance at IDP sites, which increases their vulnerability. Regarding care as part of awareness raising on domestic violence and other gender-based violence, communication capsules have been recorded and are broadcast on radio, television, and through social networks, with a view to encouraging the population to respect the right of women to prevent violence and to report all cases of violence against women during the period. With the support of the United Nations Joint Human Rights Office and UNFPA, my office will activate the geolocator call center with a free number to allow victims to report the violence suffered and to obtain the necessary services. In addition, my office works in partnership with civil society through advocacy with the government to take into account the needs in the various programs of the country. I'm sorry. Regarding the plenty model, My office is working in partnership with the foundation. Excuse me. Yeah, regarding the pregnancy model, my office is working in the partnership with the foundation so that in the community, the government can set up one-stop center because this model is ideal since it contains all of the domestic services in the same place. In terms of justice, circumstances linked to the pandemic slowed down the work of courts and tribunals because of the prohibition of the movement of people from one province to another. The pandemic doesn't create a climate of impunity because my office in partnership with the Auditor General of the Army Forces of the RDC and the prosecutor of the country to continue processing cases. I strongly call on all of our partners involved in the issue of sexual violence to provide the necessary support for the implementation of our projects, in particular the addendum to the joint communique, which is an important program that the Congolese government has set in place with the United Nations to put an end to the impunity of the of justice and as well as the holistic care of the victim. Thank you to all of you for your attention. Thank you.
Thank you so much, Madame Mulop, for your remarks and for your dedication. I'm glad now to move on to the next segment of our program, Voices from the Field. We have with us a number of UN practitioners from different countries where this agenda is being implemented, who will speak about some of the challenges and circumstances in their context. I'd like to begin by offering the floor to Beatrix Attinger-Collin from our Senior Women Protection Advisor in Central African Republic. Beatrix, the floor is yours.
Thank you, Fonderai. Excellencies, ladies and gentlemen, on 12th of June, the President of the Central African Republic announced that wearing a face mask in public was compulsory and that free masks would be distributed. This comes in addition to other measures that had been announced earlier, such as the closing of schools, hand washing installations in public, and of course, social distancing. That said, in absence of a visible danger, most measures are not adhered to by the population nor strictly enforced by the authorities. How does this affect the survivors of sexual and gender-based violence? While women and girls make up only 26% of the positive tested persons, the measures have some negative consequences. Transport has increased the costs by 60% due to the restriction of the number of passengers that can be carried by motorbikes and buses. Adding to the challenge to seek medical care, the country's weak coverage of health services is further reduced as some humanitarians had to cut down their activities with their staff being sent into telecommuting. Also, survivors are reluctant to go to hospitals because of fear to contract the virus from other patients. The weak health system struggles to respond to numerous other deadly diseases such as malaria, respiratory infections, and diarrhea. In a country with poor access to water, hygiene, and sanitation, and underlying conditions such as malnutrition, care facilities being set up for COVID-19 response also need to deal with these diseases and provide care for sexual violence victims. MINUSCA and partner organizations remain mobilized to support the government to curb the spread of the virus. Information activities for thousands of persons on hygiene and social distancing have been organized. Hundreds of community focal points and volunteers were trained for door-to-door awareness raising. The general lack of understanding of the pandemic makes communication crucial. For example, in Cacabandoro, in the center of the country, MINUSCA supported the women of the National Protection Network for Victims of Sexual Violence to conduct educational sessions on the virus and the need to continue to seek treatment for all medical issues, including the effects of rape. MINUSCA also adapted its community violence reduction programs, benefiting members of armed groups, community members and youth at risk. 185 beneficiaries who learned sewing through vocational training are now producing face masks at the rate of 100,000 per month to be distributed to the local market. The impact of the pandemic extends beyond the question of sanitation. In April, 2 presidential decrees ordered the partial release of prisoners to avoid the spread of the virus in congested prisons. What followed was the release of 676 prisoners, of whom several have been convicted of rape. This poses a protection challenge for the victims and witnesses who could potentially suffer from reprisals. Lastly, following the Secretary General's call for a global ceasefire, some armed groups committed to respecting it. However, human rights monitoring, even though reduced due to the confinement of staff, shows that women and girls continue to be attacked and raped on their way to provide water and food for their families. The risk of falling victim to sexual violence has not diminished in this crisis, but the possibility to seek assistance and redress has. The uncertainty of what is to come needs to have us stay alert and increase support to those that can reach out, such as the mentioned National Protection Network. Thank you.
Beatrix, thank you very much for your informative perspective. Before going on, I just would like to remind, in the interest of time, colleagues to keep presentations to the allotted 3 minutes so that we can keep the program on track. I'm delighted now to invite our Senior Women Protection Advisor from the DRC, Gillian Kitley. Gillian, you have the floor.
Ms. Beatrix, if you can stop your presentation, please. Ms. Beatrix, please stop your presentation. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen. When cases of COVID-19 first reported to DRC, the government took quick action to put in place measures to prevent the spread of the virus, closing borders, restricting travel within the country, prohibiting gatherings of more than 20 people, and locking down COVID-19 hotspots. MINUSCA's activities linked to the protection of civilians are considered critical, and with the government's support, we work to continue these activities while respecting preventive measures and making sure that there was no risk that we could ourselves spread the virus. Inevitably, though, there has been an impact on our work. We have had to postpone outreach and capacity building activities, which will involve more than 20 people. And while in most places we continue to carry out monitoring and investigation missions, in some instances we've had to postpone important missions. For example, we've been planning a joint investigation mission to locations in South Kivu, where we had earlier documented mass rape. This mission would support a judicial investigation and bring much needed medical, legal, and psychosocial assistance to the survivors. Initially postponed when the capital of South Kivu, Bukavu, was placed under lockdown, it was postponed again 2 weeks ago after a sudden increase in COVID-19 cases there. We couldn't take the risk of spreading the virus, but we and our national partners are committed to conducting this mission as soon as we can do so safely. We welcome the commitment of the government to the prevention of sexual violence and to prosecuting those responsible. We also welcome the cooperation that we enjoy with Madame Yelu Moulon, the Presidential Advisor on Youth, Gender and Sexual Violence, who just spoke about ways in which COVID-19 prevention measures have affected women and women survivors of conflict-related sexual violence. We know from our own experience that in some areas, survivors of conflict-related sexual violence are reluctant to access medical care now for fear of contracting COVID-19 or of being perceived as a carrier. We know that social distancing rules mean that health centres and mobile clinics have reduced the number of patients they see. Judicial clinics have reduced activities in support of survivors. And organisations providing psychosocial assistance and counselling have suspended these activities in some places, as well as social, economic and reintegration activities for survivors. There have been delays in priority trials of individuals charged with crimes against humanity for sexual violence, such as the trial of former armed group commanders Sheka in Goma and Cobra Matata in Kinshasa. Following advocacy by our office, however, I'm pleased to say that the trial of Sheka has resumed this week. Policing of COVID-19 restrictions puts women and girls at risk of conflict-related sexual violence. And we have documented one case in which a woman was raped in police detention, another in which a woman was threatened with rape and sexually harassed by police following her arrest. And in both of these cases, the women were arrested for not respecting COVID-19 restrictions. And we, of course, follow up on all of these cases. MONUSCO, working with our national and international partners, is adapting to address and to find solutions to the problems that we see, and to continue to support conflict-related sexual violence survivors. The MARA Working Group provides a forum and platform for sharing information and concerns, identifying locations where resources are most needed, and mobilizing resource providers to support survivors. We will continue to work through the MARA and with our national partners to find solutions to the challenges presented by the pandemic and try to limit the impact of this period on the women, girls, boys and men who are most at risk of and suffer sexual violence. Thank you.
Gillian, thank you very much for your remarks. I'd now like to hand over to our Senior Women Protection Advisor in Iraq. Noel, you have the floor.
Thank you, Mr. Chikwa. Excellencies, distinguished guests. Each year on 19 June, we celebrate the International Day for the Elimination of Sexual Violence in Conflict. This year, this commemoration takes place under unusual circumstances. COVID-19 has changed the world as we know it and has brought tremendous suffering, including the enormous loss of life. It is therefore appropriate to showcase the interlinkages on the impact of COVID-19 on survivors of conflict-related sexual violence. In Iraq, the COVID-19 pandemic has had an enormous impact on survivors of conflict-related sexual violence, many of whom are internally displaced. Survivors have been further impacted through the imposition of measures by Iraqi authorities in efforts to address the spread of the COVID-19. The curfews halted parliamentary business, affecting progress in the enactment of laws, such as the draft Yazidi Survivors Bill. The bill calls for the qualification of the crimes against Yazidis and other minorities who were also affected by the atrocities committed by ISIL as genocide by international standards, stipulates the rights of Yazidi female survivors and establishes 3 August as a National Day of Memorial. The bill sets out various reparation measures for female Yazidi survivors of captivity. The bill also enables a forum for the issue of children born of sexual violence to be addressed. United Nations entities and civil society organizations were forced to suspend many of their activities targeting survivors. The impact of the suspension of these programs is still to be fully determined. Suspension of programs also meant that essential gender-based violence service providers were unable to deliver services during the period of lockdown. The gender-based violence subcluster in Iraq recently published findings of a rapid assessment on the impact of COVID-19 on gender-based violence. Key findings from this assessment paint a very grim picture of the impact of COVID-19. For example, the assessment found that 94% of respondents noted financial constraints, including lack or loss of livelihood or income. 92% of respondents noted stress from the confinement, and 73% of respondents responded that lack of social amenities and networks is the main reasons for reported increases of domestic violence incidents. As expected, livelihoods and cash assistance were reported as the least available services for gender-based survivors, including survivors of conflict-related sexual violence, followed by lack of access to legal assistance and then safe shelter. The lack of livelihoods has deepened the poverty of survivors of conflict-related sexual violence, as they are the most vulnerable. United Nations agencies stepped in to provide emergency support to the most vulnerable families. Iraqi authorities have responded positively to the challenges posed by the pandemic. Following the documented increase in domestic violence cases during the curfew, the Minister of Interior allowed lodging of domestic violence complaints through hotlines. The Chief Justice directed all competent courts to take necessary steps against perpetrators of domestic violence and in support of victims, particularly aiming at deterring these crimes. These are important steps in ensuring that women and girls are able to seek and to get comprehensive assistance when they need it. Additionally, the gradual easing of the movement restrictions has allowed providers of gender-based services to scale up service provision where needed. It is essential that we collectively continue to ensure that survivors of conflict-related sexual violence are not left behind in the necessary fight against COVID-19. Special attention needs to remain focused on this vulnerable group of people to ensure that their already harsh circumstances are not worsened by this global pandemic. As we commemorate this important day under difficult situations, I take this opportunity to salute the survivors of conflict-related sexual violence. One can only but admire their resilience, strength, and determination to overcome the heinous crimes that they endured. Their ever-positive approach to life gives us hope that we can overcome the scourge of conflict-related sexual violence. In conclusion, I call on all stakeholders to remain vigilant and committed to addressing the needs of survivors of conflict-related sexual violence at all levels. Thank you for giving me the floor.
Thank you very much, Noel. I'm glad now to give the floor to our senior WPA in Mali, Oshar Kouassi. Oshar, you have the floor.
Excellencies, distinguished guests, ladies and gentlemen, thank you, and please hear the voice from Mali. In Mali, the first case of COVID-19 detected in March 2020 triggered a governmental response plan that puts emphasis on the medical response and the social measures to mitigate the spread of the pandemic. The first COVID-19 related death created increasing fear within the country and was followed by an intensive of protective measures from the government, including the issuance of nationwide curfew and the limitation of working hours of all offices and business. The COVID-19 pandemic has also severely affected MINUSMA, resulting in the more than 200 infection, the death of 2 peacekeepers, and it has also disrupted the mission operational and programmatic planning. That's why an in-mission COVID-19 task force and response plan has been set up by the mission leadership to ensure the protection of all UN staff and the continuity of mandate delivery. Despite the Secretary General calls for a global ceasefire during the COVID-19, armed groups remain very active, especially in the northern and central part of Mali, and they are seeking to use this situation to expand their reach. This is further exacerbated as restrictive measures have considerably reduced the regular monitoring capacity of MINUSMA and other humanitarian actors, which increasingly obscure the already severe underreported number of CRSV cases. In the northern region, precisely Tessalit, Kidal, and Timbuktu, where medical facilities for survivors of gender-based violence and CRSV were not fully operational before COVID-19 pandemic, there have been further reduction in number of reported cases of CRSV from March to June 2020. And as protective equipment is still not widely available, social distancing not respected, and misinformation on COVID-19 prevalent, frontline workers throughout the country are extremely concerned about contracting COVID-19 while performing their duty. And as a result, this has impacted their ability to provide adequate medical and psychosocial response for CRSV. The overall security situation in Mali, including the ongoing violence perpetrated by armed groups, coupled with the spread of COVID-19, has increased the level of CRSV being committed, while simultaneously making it more difficult to monitor, to report, and track the use of sexual violence by armed actors. medical response, as well as judicial support for survivors continue to be undermined by COVID-19. MINUSMA continue to support the Malian COVID-19 response plan by providing technical and financial support to the government. Within the MINUSMA, dedicated facilities have been constructed to treat and isolate UN staff affected by COVID-19 and continues to implement teleworking and protection measures in order to protect staff and minimize the risk of transmission to the local community. Moreover, MINUSMA leadership called for all mission components to develop projects that reinforce the national response plan for COVID-19 and reallocate funds accordingly. To support this effort, Women Protection Advisors work with the MARA Technical Working Group to develop analytical note on sexual gender-based violence, including CRSV, in the context of COVID-19 breakout. This was used as a guidance for internal and external CRSV mainstreaming and response planning. Distinguished guests, ladies and gentlemen, today as the global fight against the COVID-19 pandemic is capturing the attention of all the world, survivors of CRSV need the full dedication and expertise of all stakeholders. That's why in Mali, a way out will be reinforcing the support for the joint communique, advocating for the judicial response and passing a bill of law on gender-based violence, supporting the one-stop centers, and also providing adequate staffing to address the issue of CRSV. Thank you for listening.
Ashad, thank you very much for your observations. I'm glad now to invite UNFPA's Sexual Violence and Conflict focal point in Myanmar to take the floor. Yanneke, you have the floor.
Thank you. Excellencies, honorable guests, in Myanmar, quarantines and other restrictions of movement have begun to disrupt the service provision for survivors, as well as the monitoring, reporting, and outreach work of UNFPA and United Nations entities mandated to gather information, verify violations, and enhance compliance by both state and non-state parties with international obligations, including relevant Security Council resolutions. There is a risk that the needs of survivors, as well as the need to put measures in place to prevent CRSV, are not prioritized by both government and non-government partners, as the focus has shifted to COVID-19 response. Finalization of the Prevention of Violence Against Women law has been put on hold, as has the validation of the National Action Plan to address CRSV, pursuant to the signing of the joint communique with the Office of the Special Representative on Sexual Violence in Conflict. Until now, the appointment of a senior women's protection advisor has not been approved by the government. In Myanmar, the recent intensification of fighting in Rakhine and Chin states and clashes in northern Shan and other parts of the country has led to an increased risk of sexual and gender-based violence, which is also one of the many devastating impacts of COVID-19. In Rakhine and Chin states, the recent conflict has resulted in almost 80,000 internally displaced people, bringing the total number to more than 350,000 in Myanmar. Women, girls, and boys are acutely vulnerable to sexual violence in the course of displacement or migration, and are at particular risk once in IDP camps. The potential spread of COVID-19 in IDP settings may exacerbate the already high risk of sexual violence in such situation. Furthermore, internet connectivity restrictions in parts of northern and central Rakhine state limit the reach of important primary health prevention and response advisories on COVID-19 and hamper the ability for survivors to access services. In conflict-affected states, the access for humanitarian partners is already limited, and the imposition of quarantines, curfews, and other restrictions on movement to abate the spread of COVID-19 are hampering the possibility for survivors to report sexual violence, further exacerbating the existing structural, institutional, and socio-cultural barriers to seeking redress for such crimes. UNFPA, in close coordination with the Office of the Special Representative on Sexual Violence in Conflict, together with the MARA Working Group, is, with support from the Government of Norway, continues to advocate for the validation of the National Action Plan on CRSV and continues to support civil society organizations, which are defining and providing frontline support. UNFPA continues to invest in capacity building of local CSOs in ethical data collection to support monitoring and reporting of CRSV, and of paramount importance, how to safely scale up their work to support GBV survivors. UNFPA is helping to adapt the service provision of both government and non-government partners in order to address GBV in all settings. Prevention is integrated in COVID-19 response plans. We are extending the reach of hotlines through which case management, psychological first aid, as well as GBV referrals is provided. And key messages on GBV and mental health and psychosocial support in the context of COVID-19 are disseminated through different channels, including mobile applications, social media, as well as through the distribution of dignity kits for IDPs and returning migrants in quarantine facilities. In coordination with the GBV Working Group, referral pathways and risk mitigation information are updated and disseminated regularly to facilitate access to services throughout the pandemic. Furthermore, UNFPA works closely with UN agencies and partners to ensure the continuity of life-saving multi-sectoral services for GBV survivors, including survivors of CRSV, by providing emergency contraceptives and clinical management of rape through static and mobile clinics, and GBV response services through community-based volunteers and women and girls centers in conflict-affected areas, ensuring health and safety of both clients and service providers through the provision of personal protection equipment. To conclude, we urge the government to implement a national action plan to address CRSV and to enter into a joint action plan with the UN as soon as possible. We call upon all actors today to protect vulnerable women, girls, men and boys, to put survivors at the center of the response, and to promote accountability to end conflict-related sexual violence. Thank you so much for giving me the floor.
Janneke, thank you very much for your presentation. I'd like to give the floor now to our Senior Women Protection Advisor in Somalia, Rada Shawi. You have the floor.
Thank you very much. Ladies and gentlemen, distinguished guests, conflict-related sexual violence remains a huge concern in Somalia due to prolonged conflict and gender-based inequality rooted in the various layers of the clan-based community. In 2019, the number of rape cases reported by the GBVMS was 744, of which 239 cases recorded by the MARA as cases of conflict-related sexual violence that targeted women and girls. Last year, through the support of the UN funds and programs, some 3,007 victims and survivors of CRSV received medical and health support, and more than 5,000 received psychological assistance by service providers. Services this year are severely impacted due to the pandemic, and as a direct outcome of COVID-19, Somalia is facing an increased burden on health services and first responders, potentially increasing the risk to service providers and victims and survivors of CRSV. The federal government of Somalia committed to combating sexual violence by signing the joint communique on May 2013, and the adoption of the National Action Plan that was operational since 2014 up to December 2017. During the visit of the Special Representative of the Secretary General on Sexual Violence in Conflict to Somalia in July 2019, the federal government of Somalia renewed its commitments under the joint communique and requested the United Nations to support the development of a new national action plan that draws on the best practices and lessons learned from the National Action Plan of 2014. The state level and the security sector consultations that would lead up to the development of the new NAP were suspended this year in April due to COVID-19 emergency. However, my team, together with various mission components and the UN agencies, funds and programs, are engaged on prevention and response of CRSV. My team has ensured that CRSV concerns are integrated in the mission COVID-19 emergency plan as priority area, includes monitoring and reporting of cases of CRSV and coordinated of response and provision of technical assistance to strengthen the response of the government and the civil society partners. There have been a number of cases reported through MARA this year, including a case of a gang rape of 2 young girls that attracted outrage of the population and the attention of the government and the UN at the highest level. Other CRSV cases, including gang rape, were reported and verified through a newly established task force by the Attorney General Office. The task force meets regularly through virtual means since last April to follow up on reported cases and to ensure provision of medical and legal support for victims and survivors. It is encouraging to see the leadership of the Attorney General, which is key to push for justice measures in relation to SGBV and CRSV. The Attorney General has publicly denounced the mediation of sexual crime cases by the traditional elders. My team is also providing direct support to the business continuity plan of the Ministry of Women and Human Rights Development, including on training, capacity building, awareness raising, and inter-ministerial coordination. On the rule of law, COVID-19 has had detrimental impact, including access to justice. For example, Somalia Attorney General Office has said that suspension of court work during the pandemic has resulted in 0 convictions for sexual crimes since April 2020. In addition to the inadequacy of legal framework to hold perpetrators to account, noting that rape is classified as crime against morality under the current penal code, while the sexual offences bill has been returned by the Parliament to the Cabinet last February and yet to be revised and sent back to the Parliament, a plan that has been further suspended in the context of COVID-19 emergency and the recession of the Parliament. If enacted, the sexual offences bill will create a rapist and survivor-centered legal framework in line with Security Council Resolution 2467 for 2020. Lastly, I would like to highlight the recent UNFPA Health and Demographic Survey of Somalia that indicated the emergency situation exacerbates the gender-based violence, including early marriage, notably as it constitutes an additional source of income during the difficult economic situations to the midwives and other traditional practitioners. Girls are not going to schools, and the holiday season is preferred time for the practice to take place. Also, fears regarding the future promote this practice as it seems culturally important for the dignity of the girls and the family as well. I would like to put forward key recommendations that would be of great value to push forward Somalia's efforts to eliminate sexual violence in conflict. The enactment of sexual offences bill and providing support to the justice sector to ensure accountability and justice, including allocation of resources to meet the growing needs of victims and survivors during this time of emergency. It is equally important to support the efforts of the federal government of Somalia, led by the Ministry of Women and Human Rights Development, in implementing the joint communique and developing the new national action plan. I thank you all for listening.
Nada, thank you very much for your remarks and for your work in a very difficult context. I just want to remind colleagues of our time constraints and to keep presentations brief. And now I would like to give the floor to our Senior Women Protection Advisor in South Sudan, Huma Khan. You have the floor.
Thank you. Excellencies, ladies and gentlemen, South Sudan, which became independent in 2011, has been going through a civil war since 2013, which has not stopped. It has only gone through phases. South Sudan is also a civil war where sexual violence is probably the most used weapon, and you come across very commonly women and girls who have been repeatedly sexually violated. It's also a nation that has weak infrastructure, and particularly its health infrastructure is extremely poor. As per WHO guidelines, at least there should be 2 functioning health facilities per 10,000 population. However, South Sudan barely has 1, if at all. These health facilities are mostly more than 5 kilometers walking distance from the nearest village, which discourages women and girls in South Sudanese context because roads are not safe for them to walk to these facilities. As a result of that, in a recent study that was conducted by UNMISS and OHCHR, we found that women and girls often approach medical facilities after rape only when they develop complications, because facilities are not close to them, and there is also heavy stigma attached to sexual violence. So women prefer to keep quiet and not talk about it. That is the condition of sexual violence survivors in a country like South Sudan, where many keep quiet and health facilities are not adequate. Some of them also told us that when they approached health facilities, the care that they needed was not available. South Sudan is also a country that chooses to spend only 1.2% of its national budget on healthcare. So health sector is primarily completely supported by international donors who provide quite a lot of support, but at the same time, the responsibility of the government is really little in providing healthcare to its citizens. In this context, we have the pandemic now, and you may realize that it already poses a lot of challenges in a context where health facilities are very few and extremely poor. We already received reports of less and less women and girls visiting health facilities due to fear of infection, and also due to added stigma of COVID-19, because COVID-19 also has stigma attached to it in a context like South Sudan. So we already see that there are fewer women and girls approaching health facilities. However, despite global calls for ceasefire, conflict continues, particularly in Central Equatoria province between government forces and one of the non-signatory armed groups, NAS, and in Jonglei state, where it's in the name of intercommunal violence, and large number of women and girls have been abducted between February and April by two groups who have been given then in forced marriage or have become a tool to negotiate cattle between the two tribal groups. In this context, you all may realize that it's extremely hard for any service provider to reach many of these women and girls. Service providers are also struggling to balance protection of their own staff and then to protect those that they are meant to protect. As far as UNMISS is concerned, we are also developing new strategies every day and trying to learn from the new situation. One of the things that has worked very well for us is to work with grassroots groups and faith-based groups because they are present in the community. So using them as the first respondents and people who raise awareness, who inform women and girls about what they should do in case of sexual violence. We are trying to get some support for these small groups, and I'm happy to say that through support from Office of SRSG SVC, we've managed to get some support for one or two groups, and we are working to get more support for smaller groups and community-based groups, and working closely with them, providing them with material so that they could work closely with women and girls. UNFPA has recently launched a helpline, which is one tool for women and girls to access when they are not able to see face-to-face for counseling support. We are also encouraging a number of our partners to use other alternative means to provide psychosocial support and counseling. As far as physical protection is concerned, we have been having for the last couple of months this quick deployment policy of force, where we try to go by early warning and deploy force as a preventive measure as soon as we have early warning. And it has been giving good results in terms of at least mitigating some of attacks on civilians. But lately, COVID-19 has also provided the government with a tool to have more bureaucratic processes. So now for accessing certain areas, we have to have more permissions, and that is taking time. So that is also limiting our ability as new measures have come into place. And sometimes nobody is clear in the government how they are going to be implemented. Sometimes it's unintentional, but it has resulted in more delays in our deployment at times, which is really concerning. As I said, these two strategies have worked well for us, and we are evolving our strategies on a daily basis. We have very good communication systems and one of the most listened radio channel in South Sudan, which has come handy for us to also inform people about sexual violence in this kind of situation. South Sudan has received a lot of donor support to respond to COVID-19, but some of that support has come with the condition not to be used for sexual and reproductive health. I would like to appeal to member states, as I have this opportunity to appeal to you today, on two things. One is global call for ceasefire, because unless South Sudanese parties to conflict abide by ceasefire, we will not be able to really support all civilians, and particularly women and girls who are being subjected every day to sexual violence, to adhere to their commitments that they have made to denounce sexual violence. And all these parties who are at war at the moment have made these commitments. So it would be really useful for South Sudanese that there is more pressure on these parties to adhere to their commitments and to respect global call for ceasefire. The second appeal I would make is not to make any funding conditional, because COVID is the primary problem that we are all facing, but it's also not the only problem that we are facing. Their sexual and reproductive health in a context like South Sudan remains one of the key challenges. And if there is funding which comes with condition, or if we try to prioritize sexual and reproductive, other COVID over other types of healthcare, it's not going to help our women and girls in particular, and even men and boys, as the numbers are, as I told you, the numbers are huge. So I would like to take this opportunity to make these two requests to all member states who are here, to put more pressure on South Sudanese to abide by global call for ceasefire and to try and support sexual and reproductive health work in this time of pandemic. Thank you very much.
Uma, thank you very much for all your work. I'm glad now to give the floor for our last voice from the field, Ruth Kibiti, our Senior Women Protection Advisor in Sudan, Darfur. Ruth, you have the floor.
Thank you very much, Dr. Rai, and Your Excellencies, distinguished guests, ladies and gentlemen, and fellow colleagues. Good morning and good afternoon. Good morning and good afternoon. For my part, from Darfur region, I want to focus on the rapid spread of COVID-19 in Darfur and look at the impact of our work. I'll also want to look at the new developments in Darfur in terms of how they are impacting on COVID-19. In terms of impact, senior women protection advisors and women protection advisors have been engaged in public advocacy and awareness raising in Greater Jebel Mara area of Darfur, which has led to communities prioritizing medical attention for survivors and reporting of incidents to police. But this work has been interrupted by the arrival of COVID-19 in the Darfur region. The COVID-19 arrived in Darfur in March 2020, and it led to the lockdown of two team sites, two very critical team sites, because they are in the hotspot areas. The team site in Tas and the team site in Shanglia, Tobaya were locked down. Tas was locked down for 28 days, and the Shanglia Tobaya for 3 days. It meant that humanitarian monitors, human rights monitors, and women protection advisor monitors could not get into the area and do anything or monitor and report on CRSV and survivors of CRSV. Therefore, the work was significantly affected, and we could not even access or know whether the survivors were accessing services because nobody could get into pass area during the lockdown. This also means that the survivors of CRSV could not access services, medical services, and this really was a big disadvantage to them. In terms of mobilization and support, we also need to mobilize and increase resources for awareness raising and advocacy to change the attitudes and reduce stigma and discrimination of survivors of sexual violence in conflict. Our own experience is that the areas where UNAMID women protection advisors have had advocacy and awareness raising in areas like Natiti, Sorotoni, and Gogolo. Even when COVID-19 is ongoing, there have been increased numbers of incidents reported on CRSV. And this is because of the fact that we put a lot of extensive advocacy and awareness raising to encourage communities to report incidents of CRSV and also encourage the survivors to seek medical attention. The second aspect is that in the Darfur area and generally in Sudan, there is lack of safe shelters for survivors of sexual violence in conflict. Today, I want just to make an appeal to the international community and particularly to the donor community present who have been engaging with the government, the transitional government of Sudan, to encourage the government of Sudan to accept the construction of safe shelters for survivors of sexual violence in conflict. I also want to urge and encourage the government of Sudan to enhance investigation and prosecution of crimes on sexual violence. We recall that many times we have been talking about issues of sexual violence in Darfur, but the most disappointing fact is that these issues are not being prosecuted. And that's why we are appealing to donors to encourage the international community to encourage the government of Sudan to enhance investigation and prosecution of crimes on sexual violence. The other aspect that I want to focus on is the positive element. First of all, let me start by congratulating SRSG Pramila Patin. She worked so hard from 2018 when she came to Darfur and the Sudan to ensure that by at least March this year, a framework of cooperation was signed. Congratulations, Madam Pramila Patin, and we really look forward that this framework of cooperation is going to be implemented before UNAMID exits Sudan, because we really waited for this framework of cooperation to be signed, and now it has been signed, and we are looking forward that this framework of cooperation is going to be implemented. The only challenge is that the framework of cooperation was signed at the time when the whole world was going through COVID-19, and there was a ban on travel. And therefore, the framework of cooperation has not been launched in Sudan. And because it has not been launched in Sudan, we are not able to engage in advocacy, in awareness raising and dissemination on the framework of cooperation. So we are looking forward for the time when Madam Pramila Patin will be coming to Darfur and to Sudan to launch the framework of cooperation. This year has also been a very good year for the women of Sudan, because again, the Minister for Labor and the Social Development recently has tirelessly led the adoption of the National Action Plan on the implementation of Security Council Resolution 1325. This is a positive score for the women of Darfur and the women of Sudan. And what we are now looking forward to is the implementation processes. I agree that this is a positive score, but however, we need resources. We need resources for the implementation of the framework of cooperation, and we also need resources for the implementation of the National Action Plan for the UN Security Council Resolution 1325. The minister has also worked hard to ban female genital mutilation in Sudan, and we are hoping that there will be more resources to ensure that the actions are taken to promote the empowerment of women and ensure that the young girls who go through FGM are also empowered. I also want to focus on action implementation of these key policy issues. We want to look at the need for the framework of cooperation to initiate development of the implementation plan. This is an urgent issue. That actually the framework of cooperation should, by this time, 3 months down the line, we should be having an implementation plan in place. But this has not happened. But because of COVID-19, and the women who need to understand and know about this framework of cooperation have not even received these ideas. We urge the international community to provide financial support to the government of the transitional government of the Sudan for the dissemination of the framework of cooperation across the country. Initially, we thought it was going to be disseminated in Darfur before the mission exits. But we are now thinking progressively that the incoming mission should also be supported to be able to disseminate the framework of cooperation. And I also want to say we want to build on the gains made by senior women protection advisor and women protection advisors in Darfur by continuing with advocacy and awareness raising by at the follow-up mission in Sudan and sexual violence in conflict. This is not going to be very easy without extra resources. We need extra resources because Sudan is a huge country. And those extra resources will enable us to reach all the conflict-prone countries. And finally, of course, the women of Darfur, the survivors of sexual gender-based violence, most of them are not accessing resources, are not medical services. It's now time for us to begin to see how these women can be supported to be able to access services, especially with COVID-19 around and more resources being diverted from CRSV advocacy and awareness raising to supporting prevention and protection of promotion of hand washing hygiene, including other issues of COVID-19. Thank you so much.
Ruth, thank you very much for your work and for the passion that you bring to it. To end this session, I would like to invite the Executive Director of the NGO Working Group on Women, Peace and Security, Kavier Soka, to give a civil society perspective.
Thank you so much, Chandrai. Thank you to all of you and to SRSG Patton for this opportunity to address you and provide you with a civil society perspective today. I represent the NGO Working Group on Women, Peace and Security, an independent advocacy coalition of 18 non-governmental organizations, and we work with women's civil society in over 50 countries. The COVID-19 pandemic is a gendered crisis. It's a crisis amplifying existing inequalities and affecting those most marginalized, and it's affecting women, human rights defenders, and civil society, as you've heard today. Its global impact is amplified for women and girls living in conflict. So what do survivors of conflict-related sexual violence need? Our members and partners have highlighted 3 key priorities. They need outspoken leadership in defense of their rights. They need resources, and they must be included and heard by all of you, member states and the UN, when you make decisions that affect their daily lives. Let's start with their rights. All women and girls need and have the right to sexual and reproductive health services. But arguably, nowhere is that need more acute than in conflict settings, which see increased rates of sexual and gender-based violence against women and girls. Even before the COVID-19 pandemic, more than 500 women and girls in emergency settings were dying every day during pregnancy and childbirth, mostly due to the absence of adequate services, as well as from complications due to unsafe abortion. Now, due to COVID-19, the deprioritization and disruption of access to these essential services in conflict settings is already a reality, precisely when women and girls, including survivors of conflict-related sexual violence, need them the most. If the sexual and reproductive health needs of women and girls are not incorporated into the global COVID-19 public health response, significant rises in avoidable mortality will occur. You can and must do more to protect the rights and lives of women and girls. What resources do survivors and the organizations that serve them need? The Secretary General's appeal in April for a ceasefire on domestic violence was an important call for governments to ensure that prevention of violence against women is a key part of their national response plans for COVID-19. Yet, women in conflict-affected communities tell us that the response from states has not been proportionate to the scale of the crisis. $305 million was being spent at the peak of COVID response on GBV programming. As of 20th May 2020, that constitutes 8% of the funding required to combat GBV. that means 92% of the need is not being met. We need to see GBV as a strategic priority in the global humanitarian response plan, an ongoing priority at the country level, and it must be resourced. Donors need to be asking for this, advocating for this, and conditioning your funding to the UN on prioritizing the needs and rights of women in conflict-affected communities. Finally, how do we ensure the representation and agency of survivors and the organizations that serve them? We must recognize that to defeat COVID-19 and rebuild a better, more equal world, all key actors, the Security Council, member states, and the UN must take concrete steps to enable women and girls to lead and contribute to the solutions to the crisis, not merely to seek to protect them from violence. We must be vigilant that the language of vulnerability does not relegate women, including survivors of conflict-related sexual violence, to objects of protection rather than as agents of change. This means requiring women's meaningful participation and leadership in planning and implementing COVID response, and involving local civil society, particularly women-led organizations and those working on human rights. Women are at the front lines of the pandemic in many of these countries. They know what their communities need, and they are best placed to reach them. But they deserve your support so they can carry out this important work. Thank you.
Thank you very much, Kavya, for your, as ever, precise recommendations. We have ended the segment, which is from the field. I am very much aware that we are short on time. I want to let everybody know that the webcast will continue, so there is no cutoff time for the webcast in order for us to be able to accommodate a number of stakeholders list. I'm honored at this time to give the floor to our first representative from Lord Ahmad of the UK, Prime Minister's Special Representative on Preventing Sexual Violence and a fast supporter of the Office of the Special Representative, if I may add. Lord Ahmad, you have the floor.
Good afternoon, Tondere. Thank you. Pleasure to join you here from London, and a special hello to Pramila Patten. Pramila, it's lovely to be on a call with you, albeit virtually, and indeed, Your Excellencies, ladies and gentlemen, a pleasure to join you today also in the presence of Royal Highness, the Countess of Wessex. As we mark International Day for the Elimination of Sexual Violence in Conflict, I, as the United Kingdom Prime Minister's Special Representative on this issue, am proud of our determination to tackle these most abhorrent of crimes. We are also extremely grateful by the support we now have of Her Royal Highness, which has really brought this issue to a new level in terms of international understanding and profile. And we look forward to working with Her Royal Highness as we move this agenda forward. The United Kingdom remains committed to take action to prevent conflict-related sexual violence, action, importantly, to support survivors, to tackle the stigma they face, the appalling sense of stigma, and action also to strengthen the importance, as we've heard already, of justice and to hold perpetrators to account. Yet, sadly, as we mark this important day, we know that conflict-related sexual violence is a pandemic we have yet to cure. COVID-19 is an unprecedented threat to how we respond to these crimes. The impacts of this pandemic are stark. Crucial medical and psychological services are directly at risk as governments divert resources towards their response. And it's understandable, but restrictions on movement limit physical routes for survivors who report crimes or indeed to move to safety. Stay-at-home measures mean those in abusive situations are even more vulnerable to violence. These are exceptional times. We must provide an exceptional response. That is why I'm delighted on behalf of the United Kingdom today to announce that we are launching the draft Murad Code for global consultation. Developed with Nobel Peace Laureate, the courageous and incredible Nadia Murad, This code of conduct puts survivors rightly at the heart of our collective response. It seeks to uphold international standards for recording the sensitive nature of sexual violence crimes, and it therefore prevents the further traumatization of survivors by ensuring that governments, international organizations, and indeed civil society actors adhere to the principles of the code. It also further reinforces evidence collection, strengthening both justice and accountability. In light of this pandemic, the Murad Code is all the more urgent and important. Limited legal services are under increasing strain and diverted government facilities, and personnel have been narrowed with the bandwidth for safe survivor-centered reporting and, importantly, collection of evidence. The draft code is now online. I therefore urge you all to consult and collaborate with us to strengthen and support it. The Murad Code will complement other UK efforts to support survivors, including the Declaration of Humanity, by faith and belief leaders, and an international centre to promote accountability for these crimes. I hope you will be able to support these ambitious initiatives, and we welcome the chance to discuss these further. To succeed in eliminating the scourge of conflict-related sexual violence, more than ever, today, now, in these most unusual and unprecedented of times, we must continue to work together to put survivors at the heart of our work. And we continue as a United Kingdom to look forward to working with our international partners and the Office of the SRSG in working together on this important aim. Thank you.
Thank you very much, Lord Ahmad, for all that you do and all that the UK government is doing. I'm delighted now to give the floor to Ambassador Olof Skog, representing the European Union. Välkommen, Olof.
Can you hear me now?
The floor is yours.
Yes, thank you. I'm not sure whether I'm being heard.
We can hear you clearly. Your feet.
Thank you very much.
Please go ahead.
Look, colleagues, I'm very grateful to be part of this debate, and I've listened very, very closely to all the interventions. Thank you for those briefs and for the work that you're all doing on this incredibly important topic. I've also I want to say that we look forward to seeing the Murad Code when it comes our way, and that we've very attentive to the messages passed on, including for meaningful participation of women and girls, and for the very strong call from South Sudan on getting all of us behind the call for a global ceasefire. We're fully behind that. Colleagues, conflict-related sexual violence does not begin with crises like COVID-19, but the chaos and instability caused by a crisis like this one leave women, girls, but also men and boys occasionally in a more vulnerable position. The increased burden on health services makes it even more difficult for survivors to get the care they need, while limitations due to lockdowns and other restrictive measures further hamper the ability of justice and rule of law institutions to carry out their work. 2 months ago, the Secretary General sounded the alarm and urged us all, the international community, to stop the horrifying surge in gender-based violence. We, together with 146 member states and observers, joined the statement the EU launched with other partners to support the Secretary General's call, and together we expressed our resolve to take action and ensure that no survivor is left behind. 2020 marks the 20th anniversary of the Women, Peace, Security Agenda. In the past 20 years, the Security Council has adopted a solid framework to address conflict-related sexual violence, as outlined by the High Representative Joseph Borrell and SRSG Pramila Patten in a joint statement that was published yesterday. What we need now is implementation in order to 1, prevent conflict-related sexual violence, 2, protect survivors, 3, end impunity for perpetrators, and 4, guarantee access to justice, reparations, and redress for survivors. We in the EU were trying to redouble efforts during the COVID-19 to mitigate further risks and eliminate all forms of sexual and gender-based violence, including conflict-related. First, we are placing women and children at the center of a response. The Team Europe package, which is worth more than 36 billion euros and still counting, identifies women and girls as a priority group in our coronavirus response and recovery. We are ensuring that all analysis, measures, and actions taken are inclusive, gender responsive, and age sensitive, and take into account the needs of all people, including LGBTI people. Ongoing life-saving responses must continue as much as possible, with adaptation as needed. Second, we are adapting existing programs and launching new ones to respond to the challenges of COVID-19. Through the EU-UN Spotlight Initiative, concrete projects are being implemented to scale up existing hotlines and shelters, etc. With the funding of over 500 million euros, it is the largest global investment to eliminate violence against women and girls. I just want to pitch for others to come in and support and join that initiative. We also continue efforts to end child violence in various settings and eradicate child sexual exploitation. We recently launched a 10 million euro program to maintain and reinforce child protection mechanisms in sub-Saharan Africa during the COVID-19 crisis. Third, we are making sure that efforts are driven by survivors and those who represent them, in particular women-led organizations and women human rights defenders. We were one of the first contributors to the Global Survivors Fund, launched by Nadia Murad and Dennis Mukwege last year. We have also mobilized 15 million euros for direct and flexible support to women's and grassroots organizations through the UN Trust Fund to end violence against women, and the Women's Peace and Humanitarian Fund, both of which we encourage others to join in as well. We are committed to continue these efforts by co-leading the Action Coalition of Gender-Based Violence under the Generation Equality Forum next year. Human rights are always most at risk in times of crisis. We remain committed to the promotion, protection, and fulfillment of all human rights and the full and effective implementation of the Beijing Platform for Action, the program of action of the International Conference on Population and Development. And we remain committed to sexual and reproductive health and rights. And I think there's been some very powerful testimonies in today's debate about the need to stand up for this right. And we are ready to step up and support these rights wherever they are being challenged. And I'm afraid that happens quite too often. At a time when the rules-based international order is facing increased pressure, the strengthening of the international criminal justice system is more important than ever. So the EU reaffirms our full support to the International Criminal Court and invites all states that have not yet done so to consider joining the ICC to end impunity for the most serious crimes, including conflict-related sexual violence. On this day, like every day, count on us, the European Union and its member states, to take full part in this collective efforts to end this abhorrent crime. I thank you very much.
Thank you so much, Ambassador Olaf, for all you're doing in your current capacity and in your previous capacity on the Security Council. I'm glad now to give the floor to Ambassador of Japan. Ambassador, you have the floor.
Hello. Thank you, Mr. Chair, Her Royal Highness, ministers and distinguished participants for their very timely and important and informative remarks. But I'm especially pleased to hear the voices from the field, and we are very much appreciative of the efforts on the ground you are conducting. Well, in the midst of this unprecedented crisis caused by, we must to minimize the negative impact and build back better a resilient and inclusive society where all individuals, including survivors of sexual violence and conflict, are able to live and do and empowered. But I would like to share, the government of Japan is determined it's through three providing 5 million US in assistance to the 4 UN Women COVID-19 response, which include activities to respond to sexual and gender-based violence. Second, supporting the projects of the team of and in the Central African Republic and the Democratic, as well as the UN Action Center. The third, making a contribution €1 billion for the Global Fund for Survivors of Conflict-related Sexual Violence comes its unwavering commitment to eliminate sexual violence in conflict. To this end, we are determined anew to work even closer with all stakeholders, including the SRSG SVC Ms. Patton and SRSG Ms. Gamba, with the idea of human security in mind. Thank you very much.
Thank you so much, Ambassador Shekane, for your statement and also for the strong and steadfast political and financial support of Japan, of the government of Japan to this mandate. I'm glad now to give the floor to the permanent representative of Morocco to the United Nations. Ambassador Hilal, you have the floor.
Thank you very much. I would like to thank Argentina and the Office of the Under-Secretary General, the Special Representative of the Secretary General on Sexual Violence in Conflict, Ms. Pramila Patten, and Special Representative of the Secretary General for Children and in Armed Conflict, Ms. Virginia Gamba, for convening this important event, and thank all the panelists for their valuable inputs. Only a few years ago, the world rose the tears as everyone listened to the very valiant and poignant testimonies reciting the tragic ordeals Ms. Nadia Murad and other victims experienced. Unfortunately, history repeated itself with shocking cases of other victims of rape, torture, and unimaginable savagery and brutality, depicting a chronicle of disturbing trend of using sexual violence as a tactic of war or weapon of terrorism or an act of coercion and intimidation within the family or at larger community. Recent UN reports revealed that 35% of people worldwide are sexual violence survivors. This is despicable, alarming, and calls for urgent and immediate actions to eradicate sexual violence in all circumstances, be it at time of conflict or in humanitarian crisis or in difficult contexts such as the current one with COVID-19. Therefore, I would like to underline the following points. One, the Secretary General policy brief on the impact of COVID-19 on women showed a dramatic increase in domestic violence and abuse, compounded with the lack of protection and access to support. COVID-19 pandemic is making inequality more visible and showing acute disparities in wealth and access to socio-economic and legal services, which are critical for empowering people, especially those who are the most vulnerable. Two, the Kingdom of Morocco, together with Argentina, Mongolia, Namibia, New Zealand, Turkey, and the European Union, presented a joint declaration to endorse the Secretary General's appeal for peace at home in homes throughout the world, supported by a number of member states. Three, right after the announcement of the Secretary General's appeal and upon high directives of Her Royal Highness Princess Lalla Mariam, President of the National Union of Moroccan Women, the Kingdom immediately implemented a series of measures to prevent violence against women and girls during the health confinement and to strengthen the national mobilization around the victims and the survivors, believing that they must have access to justice and other necessary social services at all circumstances, including during the lockdown
due to COVID-19. Some of these measures includes A, dedicating a free smartphone application, Kulluna Ma'ak, which means all with you, to listening, supporting, guiding, and combating all forms of violence against women and girls, accessible 24 hours, and uses geolocation to track the victims. This application was made in partnership with the Ministry of Justice, the Royal Gendarmerie, the Directorate General of National Security, the Ministry of Health, and Ministry of Solidarity, Social Development, Equality, and the Family, to name a few. B, the launch of direct phone lines, 8350, with regional listening cells across Morocco, open 24 hours a day, especially dedicated to women and girls victims of violence during this period of confinement. C, disseminating messages on the phones in order to overcome the psychological effects of confinement and attract attention to the need to reinforce the values of coexistence and shared responsibility within home. To conclude, I would like to underline that COVID-19 pandemic has a significant and detrimental impact on all aspects of the rule of law response, including accountability for sexual violence. This means we must double efforts to address the limitation on the availability and capacity to receive and process reports on incidents of sexual violence, to combat impunity, to provide redress for victims, and to deliver the necessary protection to those who are most at risk of violence. I thank you for your kind attention.
Thank you very much, Ambassador, for your wise words. I'm delighted now to give the floor to the permanent representative of Hungary to the United Nations. Ambassador Bogaya, you have the floor.
Thank you very much. Your Royal Highness, Your Excellency, Special Representatives, dear colleagues at the fields. We just know that rape is a powerful weapon. Perpetrators purposefully use it to demolish the cornerstone of the societies. Sexual violence not only destroys the victim's health and human dignity, but in most cases, I would say, for the rest of their lives, it also breaks down the families and shatters society. To fight perpetrators is a multifaceted strategy, and we must act together. It, I believe, needs a holistic approach, and there must be an effective cooperation amongst member states, international organizations, the civil society, and the religious and business groups. Hungary aligns itself with the statement of the European Union, but just let me say a few words in my national capacity. We supported the Secretary General's call for global ceasefire and his call for peace in home. They are also regular contributors to the UN Trust Fund to end violence against the women. We strongly believe that sexual violence in conflict is an impediment to international peace and security, a serious violation of human rights, an attack on women's empowerment, and of course, a tactic of war and terrorism. It constitutes war crime and may amount to crimes against humanity or genocide. In the context of the COVID-19 pandemic, in the time of Corona, we have had the responsibility to take all measures to prevent this scourge and support survivors and ensure accountability for perpetrators. The focus should be on survivors. As we just heard from the Countess of Essex, who pointed out, we must listen to the survivors and act accordingly. The focus, as I said, we believe, must be, and it is, on the survivors, who are most often women and girls, men and boys, as well as children born as a result of rape. We should prioritize in our COVID-19 response, providing safe reporting mechanism, shelters, comprehensive health care, and psychological support, access to justice, as well as legal and socioeconomic support to survivors and their children. In Hungary, crisis centers, secret shelters, and all-day hotline remained available to survivors during the pandemic, and online ambulances were set up to reach victims of domestic violence through phone calls, emails, via Skype, and other online facilities. Comprehensive support, as I said, should be mainstream in humanitarian response, peacekeeping, security sector, and judicial reforms. Claiming victory against sexual violence is only possible with a comprehensive human rights-based approach, which engages community, traditional and religious leaders in eliminating the stigma, fostering inclusion, healing and resilience, and paves the way to gender equality and the empowerment of all women and girls. And finally, I would like to emphasize that women should be guaranteed their well-deserved seat at the table throughout all consultative and decision-making processes. Civil society, who are at the front lines helping survivors on the ground, and thank you for the representative here today with us, despite challenges posed by the pandemic and its consequences, deserve our strengthened support. I thank you very much.
Thank you very much, Ambassador Bogai, for your strong personal commitment. I'm glad now to give the floor to U.S. Acting Representative to the Economic and Social Council, Ambassador Courtney Nemroff. You have the floor. Ambassador, you are still on mute. If you could unmute your microphone, thank you.
Thank you. And thank you so much to Argentina for hosting this event and for all of the panelists for your testimony and for your clarity about the actions that the international community needs to take now to prevent gender-based violence and to help the victims of it. On this day, 12 years ago, the United States proudly wrote and sponsored the first UN Security Council resolution to establish sexual violence as a tactic of war, leading the international effort to eradicate this barbaric conduct. The UNSC Resolution 1820 formally adopted this language, and today, sexual violence in conflict is a war crime. The United States just released a statement to mark this day, and we will continue to encourage others to join efforts on this important issue. I just want to take a moment to acknowledge the important announcement that Lord Ahmad made today. This is very exciting, and we look forward to learning more about this important initiative. Women cannot reach their full potential as change agents if they are unsafe in their own homes, public spaces, and institutions. We know this, and the testimonies we heard today made this so clear. The United States remains strongly committed at the highest levels to prevent conflict-related sexual violence, hold perpetrators accountable, and support survivors. We continue to promote equality and accountability by leveraging the full weight of the U.S. government, including through the Women, Peace, and Security strategy to promote human rights and dignity for all women and girls. The United States has also been the leading supporter of the Office of the Special Representative on Sexual Violence in Conflict since its inception, both politically and financially, and we're pleased to join this event today with you. Our voluntary contributions also support work in Burma, South Sudan, and other conflict-affected areas, including areas that we heard about today from the experts working in the field. While many challenges lie ahead, accountability for these crimes, from criminal prosecutions to institutional reform, are increasing. Sexual violence in conflict is preventable, and the United States remains committed to ending sexual violence and conflict using all the tools at our disposal. And I want to thank the panelists again for your compelling testimony and for the recommendations that you made today. Thank you.
Ambassador, thank you very much for your remarks and for the strong and consistent support, both political and financial, of the United States to this mandate. I'm pleased now to give the floor to Ambassador Anne Gauguin of France. Ambassador, you have the floor.
Thank you very much. Thank you very much. And I would like also to thank the two SRSGs and the Mission of Argentina for organizing this very useful and informative meeting. And I would like especially to thank all the briefers, in particular from the peace operations on the ground, for the updates on the impact of COVID, and pay tribute to all actors, especially civil society, for their commitment and action on the ground. I think today's format of a meeting with, representative of all ground peace operations, very interesting and very useful. France shares the concerns that were expressed today and supports the calls that were made. In particular, I note the 3 R's of Mrs. Patton about stopping the violence, about considering SRH services as essential, and about integrating fully the measures to address sexual violence into the COVID-19 national responses. France is, of course, very supportive of the call for a global ceasefire, and we fully support the joint statement that was issued by High Representative Borrell and SRSG Patton. We're very preoccupied by the impact that the pandemic is having, both on the capacity to monitor, to report, to investigate, and to prosecute sexual violence, but also preoccupied about the impact on the access to services for survivors, including sexual and reproductive health services. As Mrs. Patton said, no crisis is gender neutral, and the difficulties created by the lockdowns for proper reporting and monitoring are particularly concerning. We also deeply regret that sexual and reproductive health services are restricted or curtailed in places like South Sudan, we just heard, because some politicize these matters. This is really not acceptable and quite shocking when we are talking about survivors of something that is as terrible as sexual violence, as rape in conflict. And beyond the COVID-19 pandemic and its effect, we should not forget that both reports on conflict-related sexual violence and children in armed conflicts show that there is a persistent and worrying trend in sexual violence across the world. There is vast underreporting. We see that victims and survivors still fail to receive the support they need, and that impunity remains rampant. We're also concerned about the low proportion of humanitarian assistance dedicated to victims of sexual violence. This is a concern that should alert us. France firmly believes in the importance of justice, reparation, and guarantees of non-recurrence to put an end to this scourge. We therefore commend the ICC for its efforts towards ending sexual violence in conflict through justice. And the fight against sexual violence in conflict has been a top priority for France over the last 20 years, since the adoption of 1325. We have supported the creation of the SVT mandate and of all relevant Security Council resolutions, and we will continue to support the mandate. In this regard, it's fundamental that we walk the talk, and France is proud to grant 6.2 million euros to the Mukwege Murad Fund for Survivors of Sexual Violence, which was launched in October of last year for the 10th anniversary of the SVC mandate. Lastly, France believes that women's full, equal, and meaningful participation in all decision-making processes is where lies the key for systemic change, the systemic change that is needed to end conflict-related sexual violence. I thank you very much.
Thank you very much, Ambassador Anne, for your remarks. And I don't want to miss the opportunity to acknowledge the strong and critical role of France as an architect of the protection mandates in the Security Council. With that, I'd like to give the floor to Ambassador of the United Arab Emirates, Ambassador Al-Hafti. You have the floor.
Thank you. Excellencies, colleagues, the United Arab Emirates is grateful to Argentina and the special representatives for convening and preparing for today's observance. Sexual violence in conflict is a heinous crime that impedes the path to viable peace and sustainable development. COVID-19 and the burden it places on victims to report and recover from violence underscores that we must redouble our commitment to addressing the structural and underlying conditions that drive sexual violence. I would like to highlight 4 areas where we can continue to work and make progress. First, the UAE supports the Secretary General's call for a global ceasefire in the face of the COVID-19 pandemic, which would concretely curb sexual violence and enable delivery of services for victims. Second, the UAE believes that SGBV should be mainstreamed across UN operations, as ending this form of violence requires an all-of-system approach that addresses development, humanitarian, and security factors. Better inclusion of SGBV in gender and age markers is one powerful lever. Another option that we would ask to explore is integrating SGBV performance metrics into staff promotion appraisals so that good intentions are matched with good incentives. Third, we should not shy away from earmarking to ensure that sexual violence prevention and response are prioritized. We have heard clearly from sexual violence organizations that their budgets are often the first to be slashed, and we believe donor earmarking can be an interim solution. The UAE is proud to have co-hosted the End SGBV conference with Norway, the UN, and other partners last year, and to have pledged $10 million in funding for a range of anti-violence entities. We also earmarked $25 million for UNFPA in one of its largest ever humanitarian contributions to the United Nations, which funds their SGBV work in conflict-affected communities. Fourth, we should focus our efforts on documenting cases of conflict-related sexual violence. Evidence and data are vital in measuring the effectiveness of our efforts in holding individuals accountable. As we think about ways to recover better from COVID-19, sexual violence in conflict needs to be front and center in the international agenda. And the UAE remains firmly committed to a survivor-centered approach to ending sexual violence in conflict. I thank you.
Ambassador, thank you very much for your remarks. I'm pleased to invite Ambassador Christian Vanderwasser of Liechtenstein to make remarks.
Good morning, Tondarai, and good morning, everybody. I want to thank our hosts for organizing this very, very timely event. With very special thanks to the offices of the special representatives with whom we have been working very closely in the last few years. It's a pleasure for us to be able to offer some short comments. The evidence concerning the impact of the COVID-19 pandemic is overwhelming. There are very clear indications of an increase in violence and all kinds of violence around the globe in the context of the pandemic, be it domestic violence, be it violence against children, and certainly sexual violence. And we have heard a lot in this respect today. So this discussion is very, very timely. Like others, I want to add my voice to support the global ceasefire call by the SG, a call that we find to be very, very timely and certainly would have a significant impact on the topic, on the discussion this morning. While we find it regrettable that the Security Council has not been able to endorse this call. We are very encouraged by the high number of states and also conflict parties that have embraced it. We do hope that the General Assembly will perhaps be able to give political endorsement to this call expeditiously. The second point I wanted to make is that while we see an increase in sexual violence, of course, this is not a new phenomenon at all. We have seen the systematic use of sexual violence as a weapon of war very consistently over many years, and it is a phenomenon that is deeply rooted in pervasive gender inequalities. Sexual violence has been used systematically against the women and girls, but also against men and boys. And we do believe it is very important to give more emphasis and more attention to sexual violence perpetrated against men and boys, in particular in conflict and detention settings. And we want to applaud the work of the special offices of the special representatives in this respect, and also of the All Survivors Project, an NGO dealing with this subject based in Liechtenstein. The third point I wanted to make is on access. Others have made it. I think it is a problem that we see very strongly at the domestic level, be it with respect to domestic violence, other types of violences. The severe restrictions in mobility make it even harder for people to access monitoring mechanisms, and we have to do our very best and the best possible measures to make such access. My final point is on accountability. That has been made by others, our French colleague before, and others. So we want to express very strong support for international justice mechanisms, in particular the International Criminal Court, but also the IIIM, established to investigate crimes committed in Syria. Both have a very clear and important focus on the sexual and gender-based violence, and we do believe it is of the highest possible importance to continue very strong political support for them. I thank you very much.
Thank you, Ambassador Christian. It is so nice to see you well, and thank you as ever for your incisive thoughts. Last but not least, I would like to give the floor to Ambassador of Bangladesh, Ambassador Islam. You have the floor.
Can you hear me?
We can hear you loud and clear, Ambassador.
Okay.
Can hear you loud.
Thank you.
Please
Thank
go
you,
ahead.
Mr. Moderator. Thank you. Her Royal Highness, Honorable Minister, Excellencies, we convey our deep appreciation to the Mission of Argentina, particularly my dear friend Alejandro, the Office of the SRSG on Sexual Violence in Conflict, and the Office of the SRSG for Children and Armed Conflict for convening this event. We thank SRSG Patton and SRSG Gamba and all the distinguished briefers for sharing their insights today. Bangladesh has always been a strong supporter of elimination of sexual violence in conflict. In our efforts to bring this issue to the forefront of multilateral arena, we played a lead role during our membership in the Security Council in 2000 and 2001 for the adoption of the Resolution 1325 on women, peace, and security. The suffering experienced by hundreds and thousands of women around the world must constitute a critical element of our engagement at the United Nations. Our peacekeepers, particularly the women members, are playing critical roles in conflict settings to provide critical support to victims of gender-based violence. Despite our collective efforts, however, the magnitude of sexual violence in conflict is still overwhelming and appears to be pursued in an environment of near impunity and denial. The voices from the field that we heard today are a glaring example to the growing trends and concerns over sexual violence being used by both state and non-state actors in conflicts and fragile contexts. It also shows how the COVID-19 pandemic has further aggravated the situation. In recent times, for instance, Bangladesh and the international community gathered first-hand accounts of sexual violence against Rohingya women fleeing persecution of Myanmar and armed forces into our territory. The work of bringing the perpetrators to account is not making headway. The question and status of the children born of conflict remains unaddressed. The account of UNFPA focal point, Janeka, in Myanmar captures the grave situation in the northern Rakhine state and how the pandemic has further exacerbated it. Our recommendations are critically important for building confidence among the Rohingyas taking shelter in Bangladesh to return to Myanmar. So the recommendations need serious and immediate consideration with a victim-centered approach at its core, which has been echoed by many of the speakers before me. We also must ensure that the perpetrators are brought to justice and those displaced and victimized can return to their homes in safety and dignity. In conclusion, on this auspicious occasion, let us join our voices together in condemning the use of sexual violence during conflict, breaking the cycle of impunity, and supporting the victims. I thank you for your kind attention.
Ambassador, thank you very much for your remarks. And the Office of the Special Representative is very glad to be working with the government of Bangladesh in the implementation of our framework of cooperation to address conflict-related sexual violence. With that, I wish to bring today's commemoration to a close, to thank all of the speakers who have contributed, and of course, the hundreds of people who have tuned into the live webcast. I would like to announce that the Office of the Special Representative, in commemoration of the day, has relaunched a wonderful, a dramatic exhibit of paintings done by young students and Iraqi artists that was featured in the UN building physically last year. This exhibit has been relaunched virtually and is available on the UN.org exhibits page, as well as Special Representative Patton's website. So in closing, I would encourage you all to tune into the exhibit, and I wish you good day. Thank you.